What would an optimal exercise program for myeloma patients include?
The guidelines recommend moderate intensity, so where you're actually working hard enough that you can't just chit chat and have a full conversation. Some myeloma patients have no restriction on their physical activity and can do, whatever activities that they enjoy doing. Others probably need a little more guidance on what are okay and won't put too much pressure on weight-bearing bones. One of the things that's underutilized is the use of physical therapy. So physical therapy is actually covered by insurance. Any patient with myeloma or cancer-related fatigue or deconditioning can have physical therapy and have that dedicated guidance to help find the right exercises, both for any problems that someone's having or just to better recondition them in the context of their myeloma.
Are there groups of patients where exercise might not be helpful?
There are absolutely scenarios, people who have, problems with their spine, compression fractures, or, at the start of their treatment where disease is pouring, you want to be super careful. The last thing you want to do is create a new injury when trying to heal old ones. So that really comes to, the question of talking with your oncologist who understands the extent of your disease. If there's any uncertainty, working with someone like a physical therapist. And then there are other exercises too, like hydrotherapy, non-weight bearing, that can be really beneficial and safe for patients. So exploring creative options that are supervised is another really good way to go. But I do think it's most important that these be conversations with a medical oncologist, particularly in the setting of someone who is frail or has other known skeletal involvement.
Are there basic pieces of equipment patients should get for their exercise programs?
I actually don't believe so. It's nice if you do, that's a luxury. There is so much you can do without any equipment, and simple things there. Johnson & Johnson has a 7-minute app that's also free that is no equipment as well, and it's simple things like wall squats or planks, things like that. You don't need a whole gym, weights, any of that stuff to be able to do fitness in your home and in your life. There are nice things that you can certainly complement with, but it shouldn't be a barrier to people doing activities. You don't need them to do these things.
Is there any benefit to using a smartwatch or a Fitbit?
I think there is, I guess I'm wearing one. I don't really count my steps, but they do, because it's nice to set goals, and goals make you feel good when you meet them, and also it gives you kind of a benchmark of something to achieve. So some of these Fitbits are useful for goal setting when it comes to steps. There are all kinds of apps, like something like Strava, which is a community where you can log your activities. I'm a cyclist, so I have 189 friends who I see their workouts, and it inspires me, and it makes me want to, go out and try that trail or do those things. So, there's a lot of this technology can also give us information about ourselves, what our heart rate is, how much we're sleeping. It depends on how techie you get. So I think that there's information, data benefit to them, and then, for some of the apps, there's a community benefit to them as well.